Assalamu alaikum dear students. Today we will discuss anatomy most important MCQs part 1D. The first part of the small intestine is option A cecum, B colon, C duodenum and option D ileum. So the correct option is C duodenum. Explanation is the duodenum receives chyme from the stomach and secretion from the liver or pancreas. A special term refers to the interior surface of the hand known as option A caudal, B cephalic, option C plantar and option D palmar. So the correct option is D palmar. Explanation is the palmar surface is the interior side of the hand. Plantar refer to the foot. Subscribe now and press the bell icon. Never miss an update from our technologist. So this is very important MCQs. The upper 7 pair are attached interior to the sternum by their costal cartilages called option A false ribs, B floating ribs, C true ribs and option D tubercles of the ribs. So the correct option is C true ribs. Ribs 1 to 7 are true ribs attached via costal cartilage to the sternum. Ribs 8 to 10 are false ribs. A thin muscular and tendinous septum that separates the chest cavity above from the abdominal cavity below is option A diaphragm, B linea alba, C pericardium and option D rectus sheath. So the correct option is A diaphragm. The diaphragm is the primary respiratory muscle innervated by the pharynx nerve. The liver may be divided into a large right lobe and a small left lobe by attachment of the peritoneum of the ligament is option A caudate lobe, B falciform, C ligamentum teres and option D ligament. So the correct option is B falciform. The falciform ligament divides the liver into anatomical left or right lobes and contains the ligamentum. A small shallow depression is known as option A fossa, B fovea, C fissure and option D tubercle. So the correct option is B fovea. A fovea is a small pit, for example fovea capitis or femur. A fossa is a larger. So this is very important MCQs. The most tubular part of the stomach is option A antrum, B body of stomach, C cardiac and option D pylorus. So the correct option is E option D pylorus. The pylorus is a narrow funnel shaped region connecting the stomach to the duodenum. The dome shaped full of gas part of the stomach is called option A antrum, B body of stomach, C cardiac orifice and option D fundus. So the correct option is D fundus. The fundus is the superior dome often containing gas visible on X-rays. The two-layered folds of peritoneum that connect the stomach to the interior viscus is option A mesenteries B. Mesocolon, option C. Omenta, and option D. Peritoneum. So the correct option is C. Omenta. The greater and lesser omenta are fatty peritoneal folds attached to the stomach. So dear students, this is very important MCQs. The potential space between the parietal and visceral layers, which is in effect the inside space of the balloon, is called as option A. Mesenteries, option B. Omenta, C. Peritoneum, and option D. Peritoneal space. So the correct option is D. Peritoneal space. The peritoneal cavity is the peritoneal space between the parietal and visceral peritoneum containing lubricating fluid. A tubular structure that joins the pharynx to the stomach is option A. Crania, B. Cricoid cartilage, C. Esophagus, and option D. Trachea. So the correct option is C. Esophagus. The esophagus traverses the diaphragm at T10 to connect the pharynx to the stomach. Deep fascia is well defined in option A. Eyelids, B. Heads, C. Limb, and option D. Neck and limb. So the correct option is D. Neck and limb. Explanation is deep fascia is thick in the neck and limbs, providing structural support. So this is very important MCQs. The thoracic cage is made up of all except option A. Clavicle, B. Costal cartilage, C. Ribs, and option D. Sternum. So the correct option is A. Clavicle. So explanation is the thoracic cage comprises ribs, sternum, thoracic vertebra, and costal cartilage. The clavicle is part of the pectoral girdle. A muscular tube that extends from the kidney to the posterior surface of the bladder is option A. Epididymis, B. Seminal vesicle, C. Ureter, and option D. Urinary bladder. So the correct option is C. Ureter. The ureter transports urine from the renal pelvis to the bladder, running retroperitoneally. So this is very important MCQs. The most abundant form of cartilage having perichondrium membrane associated with synovial joint is option A. Costal cartilage, B. Elastic cartilage, C. Fibrocartilage, and option D. Hyaline cartilage. So the correct option is D. Hyaline cartilage. Hyaline cartilage covers articular surface, forms costal cartilage, and has pericardium. Carpals and tarsals are example of option A. Flat bone, B. Irregular bone, C. Long bone, and option D. Short bone. So the correct option is D. Short bones. The short bones, for example, carpals and tarsals, are cuboidal and primarily spongy bone with a thin cortical layer. So this is very important MCQs. The largest sesamoid bone of the body is option A. Clavicle, B. Fibula, C. Femur, and option D. Patella. So the correct option is D. Patella. The patella is the largest sesamoid bone embedded in the quadricep tendon. Ribs, scapula, and skull are example of option A. Flat bone, B. Irregular bone, C. Long bone, and option D. Short bones. So the correct option is A. Flat bone. Flat bones, for example, skull, ribs, and scapula, consist of two cortical plates with spongy bone in between. The outpouching of the testes is option A. Ductus deferens, B. Omenta, C. Testes, and option D. Scrotum. So the correct option is D. Scrotum. The scrotum is a continuous pouch housing the testes, regulating temperature for the spermatogenesis. So dear students, this is very important MCQs. An immovable joint that holds most skull bones together is option A. Ball and socket joint, B. Ellipsoid joint, C. Hinge joint, and option D. Suture. So the correct option is D. Suture. Sutures are fibrous joints between skull bones permitting growth in youth and fusion in adulthood. A firm structure laying posterior to the testes with the vas deferens laying on its medial side is option A. Epididymis, B. Omenta, C. Red testis, and option D. Scrotum. So the correct option is A. Epididymis. Epididymis store and mature sperm. The vas deferens arise from its tail. Dear students, this is very important MCQs. The human skull consists of option A. 8 bones, B. 14 bones, C. 22 bones, and option D. 26 bones. So the correct option is C. 22 bones. The adult skull has 22 bones, 8 cranial, 14 facial, excluded the ossicle. Dear students, this is very important MCQs. The dilated part of the alimentary canal between the esophagus and small intestine is called option A. Colon, B. Esophagus, C. Jejunum, and option D. Stomach. So the correct option is D. Stomach. The stomach stores food and secretes acid or enzymes before releasing chyme to the duodenum. A fibromuscular glandular organ that surrounds the prostatic urethra is option A. Epididymis, B. Prostate gland, C. Red testis, and option D. Scrotum. So the correct option is B. Prostate gland. The prostate gland secretes alkaline fluid into semen and surrounds the urethra at the bladder base. The shaft of the long bone is also called option A. diaphysis, B. epiphysis, C. metaphysis, and option D. medullary cavity. So the correct option is A. diaphysis. The diaphysis is the tubular shaft cortical bone surrounding the medullary cavity. The apex of the heart is formed by the left ventricle and is located at option A. third intercostal space, B. fourth intercostal space, C. fifth intercostal space, and option D. sixth intercostal space. So the correct option is C. fifth intercostal space. The apex lies in the fifth left intercostal space, mid-clavicular line. If you like this video, please subscribe my YouTube channel. अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे YouTube चैनल को सब्सक्राइब ज़रूर करें. The stomach is dilated part of the alimentary canal between the esophagus and dash. Option A. large intestine, B. larynx, C. pharynx, and option D. small intestine. So the correct option is D. small intestine. The stomach connects to the duodenum, first part of the small intestine, via pylorus. Because the left lobe of the liver is smaller than the right lobe, option A. left kidney is higher than right, B. right kidney is lower than left, Option C, right kidney is higher than left, and option D, all of the above. So the correct option is right kidney is lower than left. Explanation is right kidney is slightly lower due to the right lobe of the liver is larger. The left kidney is higher. The short gastric vein and the left gastroepipolic vein joins the option A gastric vein, B hepatic vein, C iliac vein, and option D splenic vein. So the correct option is D splenic vein. The splenic vein receives the short gastric and left gastroepipolic vein before joining the portal vein. Which muscle is not used in the forced expiration? Option A diaphragm, B external oblique, C internal oblique, and option D rectus abdominis. So the correct option is A diaphragm. The diaphragm is inactive during forced expiration, which release on abdominal muscle, obliques, transverse, and rectus. Nerve supply for pyramidalysis is option A 12 thoracic nerve, B iliohypogastric nerve, C ilioinguinal nerve, and option D lower 6 thoracic nerve. So the correct option is A 12 thoracic nerve. The explanation is the subcostal nerve T12 innervates the pyramidal, a small triangular muscle in the lower abdomen. The best example of this joint is carpometacarpal joint of the thumb is option A condyloid joint, B ellipsoid, C hinge joint, and option D saddle. So the correct option is D saddle. The saddle joint, for example thumb, carpometacarpal joint allow opposition and circumduction. So this is very important MCQs. They are roughly cuboidal in shape and are composed of cancellous bone. Option A flat bone, B irregular bone, C long bone, and option D short bone. So the correct option is D short bone. The short bones, for example carpals tarsal, are cuboidal with a spongy bone. The cremasteric fascia is the term used to describe the dish and its fascia. Option A smooth muscle, B pyramidal, C rectus muscle, and option D transversus. So the correct option is A cremaster muscle. The cremaster muscle from the internal oblique and its fascia form the cremasteric fascia, elevating the testes. If you like this video, please subscribe my YouTube channel. अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे YouTube चैनल को सब्सक्राइब ज़रूर करें. So this is very important MCQs. All are muscles of anterior abdominal wall except option A external oblique, B internal oblique, C psoas muscle, and option D rectus abdominis. So the correct option is C psoas muscle. The psoas is a posterior muscle, flexes the hip anterior wall muscle, external internal oblique, transversus abdominis, rectus abdominis. Transversus abdominis muscle is supplied by all except option A iliohypogastric nerve, B ilioinguinal nerve, C lower 6 thoracic nerve, and option D second lumbar nerve. So the correct option is D second lumbar nerve, supplied by thoracic nerve. T7 to T12 and iliohypogastric oblique ilioinguinal nerve. Thank you for watching my videos.